All right, welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar is part of our prostate health awareness series, Eating for Prostate Health. It is presented by Nicole Stawicki, outpatient oncology dietitian at Hackettstown Medical Center, and Johanna Sakimura, outpatient oncology dietitian at Overlook Medical Center. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or chat for comments. We will try and get through all questions at the end of the presentation. At Atlantic Health System, we encourage everyone to be an active partner in their mental health care. We recommend using an online tool called MyChart to help you manage your care. MyChart is an interactive tool that gives you 24/7 access to your electronic medical record. Anyone who is a patient with Atlantic Health System can open a MyChart account. This includes anyone who has visited an Atlantic Health System provider for routine visits, vaccine visits, or even an Atlantic Health System emergency room visit. If you are not a patient of Atlantic Health System, you may have access to MyChart or similar platforms through your usual provider. MyChart allows you to manage many aspects of your healthcare. Some of the most popular features allow you to request your medical records, access your medical information, test results, medications, allergies, diagnosis, send non-urgent messages to your provider's office to request medication refills or ask questions, view your clinical notes and after visit summaries, schedule appointments online, e-check-in for appointments, which makes the check-in and rooming go much faster. This also includes the ability to e-sign certain documents, view and pay your hospital bills online, or share your MyChart with family and friends, and vice versa. If you want to set up a MyChart account, need help logging into a current account, or have questions about how to use MyChart, there is help available 12 hours a day, 7 days a week. We recognize the fear, uncertainty, and confusion that surrounds making decisions related to musculoskeletal pain. In a sea of information overload, it's hard to know what's what and where to go for the orthopedic care you need. Atlantic Health System has your back the entire way. When you've got questions, we've got answers. I am now going to turn it over first to Nicole.
Hi, good afternoon, everybody. My name is Nicole Stawicki. I am one of the outpatient oncology dietitians for Atlantic Health. I work at both Hackettstown Medical Center and Newton Medical Center, so I cover the entire Western region. Sorry about that there. So for nutrition and prostate cancer, primary prevention relies mainly on both early detection and improvement of the modifiable risk factors such as diet and exercise. There are other non-modifiable risk factors, which will include increasing age, family history, and those of African American descent. Nutritional factors have been found to have a protective effect against prostate cancer. And many dietary interventions focus on reducing chronic inflammation and circulating insulin, both of which are associated with prostate cancer development and progression. For those who aren't aware, inflammation is your body's response to illness, injury, or something that doesn't belong in your body. And insulin is a hormone that helps your body use glucose for energy and help regulate your blood sugar levels. Another dietary intervention that we would use is increasing antioxidant capacity. And antioxidants are important because they help fight free radicals, which can be harmful if the levels in your body become too high. So just some general guidelines for a healthy diet. The diet we would recommend would be heavily plant-based. So you would want to include a variety of fruits and vegetables. The more colors, the better. It should be high in fiber, which would include foods such as whole grains, beans, and legumes, in addition to fruits and vegetables. You would want to limit your processed and refined foods and avoid white products as best as possible, and limit meats and dairy products. This is a low-fat diet with an emphasis on healthy fats. You want to drink plenty of fluids, mainly water, and avoid sugar-sweetened beverages. You would want to stop smoking, and that does include vaping as well. You would want to limit or avoid alcohol consumption. And you would also want to be physically active to help achieve and maintain a healthy weight. So as far as body weight and physical activity, it has been found that a higher body mass and physical inactivity may contribute to prostate cancer risk. And this is hard because of a lot of people have desk jobs, so that does increase how sedentary you are during the day. But it was found that men who maintained a healthy body weight had a lower risk of recurrence. The goal should be 150 minutes per week of aerobic exercise and 2 to 3 sessions a week of resistance exercise, balance training, and flexibility. This does sound a lot, but if you break it down, it's about 30 minutes for 5 times a week. And that doesn't even need to be 30 straight minutes. You can do 10 minutes 3 times a day. You can split it up even further if needed, just to try to get that activity in as best as possible. Research suggests that exercise affects our energy metabolism, inflammation, oxidative stress, immunity, and androgen signaling pathways, which are crucial for the function of male reproductive organs. Several studies have shown that vigorous exercise can significantly reduce the risk of prostate cancer recurrence. And just if you are currently inactive, you do want to make sure that you are speaking to your physician before starting an exercise program. Okay, so as far as diet and cancer development, Western lifestyle and the standard American diets are associated with increased risks of many cancers, including prostate cancer. The standard American diet and our lifestyle is characterized by low physical activity, excessive calorie intake way beyond what is our estimated needs, and very high intakes of animal protein, saturated fat, and simple carbohydrates. Both elevated serum insulin and insulin resistance appear to lead to both the development and progression of cancer. A high body mass index is associated with increased risk of developing prostate cancer. And evidence does suggest that obesity is associated with an increased risk for reoccurrence. Okay, so when we are comparing a plant-based versus meat-based diet, a diet that is heavily meat-based is going to be high in cholesterol. Cholesterol is only found in animal products. It cannot be made by plants. Meat-based diets are also very high in saturated fats. They're very low in antioxidants. They're pro-inflammatory, and they're much lower in fiber. Whereas when we are looking at somebody who has a very plant-based diet, it is low or no cholesterol, very low in saturated fats, high in antioxidants, contains a lot of anti-inflammatory and phytochemicals. It's much higher in fiber, and it's higher in protective substances. A study in the Journal of Urology earlier this year in May 2024 did show that individuals with the highest intake of plant foods had a lower risk of prostate cancer progression compared to those with the lowest intake of plant foods. Okay, so when we are looking at overall carbohydrate intake, a high intake of refined carbohydrates was associated with increased prostate cancer risk in human observational studies. And when we are talking about refined carbohydrates, we are talking about foods that are overly processed, and simple carbs are the ones that are going to spike your blood sugar a lot faster. We are also looking at glycemic index and glycemic load, which were also associated with increased prostate cancer risk. And for those who haven't heard of this before, the glycemic index is a measurement of how much a specific food will increase your blood sugar level. So the higher a glycemic index of food, the more it may affect your blood sugars. So the recommendation is to limit simple carbohydrates. And these are things like candy, cookies, pastries, white and refined breads, pastas, crackers, and alcohol. And this includes sugars in beverages and processed foods. High sugar foods are very highly processed. They're refined, stripped of their nutritional value, low in overall nutrient value, and low in fiber. And these foods all appear to increase serum insulin and also contribute to insulin resistance. We do recommend a high fiber diet for prostate health. The average American only consumes on average about 16 grams per day, and most men typically need at least 30 grams of fiber in their diet. A diet rich in natural fiber from fruits, vegetables, legumes, and whole grains may reduce overall cancer risk and or prevent prostate cancer progression. So it's important, if you are not following a high fiber diet, to try to start to incorporate that. Dietary fiber also improves insulin sensitivity and reduces insulin-like growth factor. It can lower circulating hormone levels, and fiber as well will bind to toxic compounds, which are later eliminated by the body. It is important just to note that if you are not typically eating a high fiber diet, you do want to gradually increase the amount of fiber in your diet, because if you go from very little fiber to very high fiber, you may have some digestive discomfort while you kind of go through that transition process. So we do recommend slowly increasing your intake. And now I'm going to pass it off to Johanna.
Thanks, Nicole. So my name is Johanna Sakimura. I am also a registered dietitian that specializes in working with oncology patients. And I work out of Overlook Hospital in the Cancer Center. And we are lucky enough at all of our Atlantic Health cancer centers across all of our hospitals to have registered dietitians at each cancer center, if not multiple at some of our larger centers. So definitely seek out a registered dietitian wherever you get your cancer care. They can be a really important part of your team. So I'm going to dive in and take over where Nicole was, and we'll be starting with we talked a little bit about carbohydrates and prostate cancer. Now we're going to talk specifically about dietary fats, sources of fat in our diet, and the links to prostate cancer. So Nicole alluded to the fact that some studies have found an association between intake of total fat as well as saturated fat intake and prostate cancer. And saturated fat is that type of fat that we find mostly in animal foods, and primarily red meat and dairy products. We're going to go through a list of sources momentarily, but those are kind of the key sources in our diet. And so this is the type of fat from a heart health perspective that we know is associated with higher cholesterol, more of that sort of artery clogging fat that we want to try to limit in our diet overall for heart health. We also we see an association between high intakes of that and increased risk of prostate cancer. Other studies looking at foods specifically have seen a higher risk of advanced prostate cancer in people who consume more red and processed meats. Again, processed meats are things that are salted and cured. We're going to go through a list of what qualifies as a processed meat shortly as well. I think it's important to note here that limiting foods high in saturated fats is also of critical importance for heart health. And we know that cardiovascular disease is a major source of illness and death in men, and depending on the age group, the major source, the primary source of death. And that's true of people with a diagnosis, men that have a diagnosis of prostate cancer as well. So we want to make sure that a diet that we're recommending is not only healthy in terms of reducing the risk for developing prostate cancer or having a recurrence of prostate cancer if you've already been diagnosed, but also for protecting your heart health, because both of those are very important components of a healthy diet. Unfortunately, there is significant, really almost complete overlap between the recommendations for heart health in terms of dietary recommendations for improving heart health and in decreasing your risk of prostate and other cancers. So in terms of, let's look at specific foods. What do we want to try to limit in our diet in terms of fat? Which fats do we want to try to eat more of? And in terms of what to limit, we're looking specifically at red meat. Beef, pork, and lamb are all types of red meat. The American Institute for Cancer Research recommends limiting that to no more than 18 ounces per week, which is about 2 to 3 meals a week. And it's completely fine, encouraged to be more conservative than that as well. If you do choose red meat, to eat red meat, you want to try to look for the leanest cuts to limit that saturated fat. So a kind of quick rule of thumb is to look for cuts that have the words loin or round in them, like sirloin steak, tenderloin steak, eye of round, bottom round, top round, pork tenderloin, or a center cut pork chop. These are going to be the leanest cuts with the least amount of saturated fat in them. It's also helpful to look at what you're pairing with red meat. So there's a big difference between having a huge steak, fatty steak, with French fries and or mashed potatoes, and having a small amount of red meat, say a lean steak in a stir fry with lots of vegetables and whole grains like brown rice. So you also want to look at the whole meal and what you're pairing the red meat with. So if you're going to include it in moderation, you want to, of course, have it as part of a more plant-based meal with lots of fiber as well. And then we want to, the American Institute for Cancer Research and the American Cancer Society both recommend strictly limiting processed meats. And that includes anything, again, that's salted or cured, things like bacon, sausage, hot dogs, pepperoni, salami, ham, pastrami, corned beef, bologna, and even deli meats. Even the leaner cuts of deli meats like chicken and turkey, even though they have less saturated fat, are still a processed meat. And something that we want to limit in our diet. It doesn't mean you can absolutely never, ever have these foods, but you don't want them in regular rotation on your menu. You want to try to save these for special occasions, a special breakfast out, maybe you get a hot dog you go to a Major League Baseball game and you enjoy a hot dog there when it's really part of the occasion, but not something you want to be grilling on a regular basis. And then in terms of fats, to other sources of saturated fat, outside of the meats we just discussed, would include things like cream or half and half, butter, cheese, whole milk, ice cream, and other dairy-based desserts, sour cream. Egg yolks have some saturated fat. Poultry is relatively lean, but the skin itself is higher in saturated fat. And then lard or baked goods made with butter, lard. And also there are a few vegetable sources that are high in saturated fat, and those would be coconut and palm oil. So coconut oil, you might have heard, it tends to get, in some circles, a healthier reputation. In fact, it's 90% saturated fat. So definitely not something good for your heart health, and something we want to limit from a prostate health perspective as well. So what do you want to eat? What are the healthy fats that we want to try to eat more of? Well, those are, again, those plant-based fats. So found in things like nuts, definitely something that I encourage, as a key component of a plant-based diet, people to eat more of. I always get asked, what's the healthiest nut? Which one should I be eating? They're all healthy. They all have different health benefits. Some have more of this vitamin, that vitamin. They really are all things to encourage. I encourage you to eat. A variety is actually better. So cashews, walnuts, pistachios, almonds, whatever you like, those are the nuts you should be eating. Seeds also, again, sources of healthy fat as well as fiber. Could be sunflower, pumpkin, chia, flax, hemp seeds. We're definitely seeing a lot more seeds, a lot more attention given to seeds these days. Nut butters. A lot of people are shocked to hear that peanut butter can be a very healthy food and something that a lot of people enjoy. So again, the type of fat is in there in nuts is primarily that unsaturated heart healthy fat. And as long as you're choosing, the best quality peanut butter is going to be one that just has peanuts and maybe a little salt, no added sugars. And, it can definitely be something that you can use for healthy snacks or, certainly like a peanut butter sandwich on whole grain bread or something. Avocado, another great source of healthy fat, if you enjoy that. Olive and other vegetable oils. And then fatty fish are another, these are not plant-based, obviously, but they are a source of omega-3s, which are those heart healthy fats. So things like salmon, Arctic char, sardines, even light tuna. So I'm going to move on to another discussion of dairy products. So that is one of the food groups that we see some interesting data on in relation to prostate cancer. This has been sort of like an open question on what impact do we see of intake of dairy products and the calcium, because dairy products are also rich in calcium, on prostate cancer risk. And I will say the data has been a little bit mixed, so there is no definitive recommendation at this time. But some studies have shown an association between high intake of dairy products and also high intake of total calcium, meaning calcium from food in the diet, things like dairy products, and also supplements, calcium supplements, have been linked to a higher risk of prostate cancer. Though again, the study results have been mixed. Some have not found this relationship. Some studies have found that it's, only full fat dairy products are increased risk and low fat are not. Some studies have found for all varieties of dairy products. Some studies have found that non-dairy sources of calcium, like, nuts or vegetables that have calcium, are not increased, like linked to increased risk. So it has, the data, I will say, is a little unclear at this point. I think the safest thing to do would be to enjoy dairy products in moderation if you enjoy them. They can be a good source of protein. We do need some calcium in our diet. They can contain vitamin D, so they can be very healthful components of a diet, but moderation, 1 to 2 servings a day. And also choose those that are low fat or non-fat to limit that saturated fat, which we know has a harmful effect on heart health. And also avoid taking calcium supplements unless specifically advised by your doctor. Now, it depends. Again, some patients, if you are living with metastatic prostate cancer that has spread to your bone, you may be advised to take a calcium and vitamin D supplement. So this is not, if you've been specifically advised to take a calcium supplement, you may very well need that for the importance for your bone health. But don't start taking a calcium supplement unless you've been specifically advised to do so. Moving on a little bit here too, we want to talk about some other components that may impact prostate cancer risk, may have a benefit, and that's what we call phytonutrients, which are this umbrella term for all of the compounds in fruits and vegetables and other plant foods that have bioactive activity, seem to have health benefits outside of the vitamins and minerals in the food. So there are hundreds, thousands of these compounds in different plant foods. Again, these are outside of your basic minerals like calcium and magnesium and zinc, and your basic vitamins like vitamin C and B vitamins. These are all these other compounds that foods contain that seem to have health benefits. And some of them may very well have cancer fighting activity when we look at them sort of in animal studies, in lab studies. So plant foods contain these beneficial compounds. Many of them act as anti-inflammatories. They reduce inflammation in our body, sort of that low-grade inflammation that we want to limit. And many of them also act as antioxidants. So like Nicole was referring back to, those beneficial compounds that fight that free radical oxidation damage that happens to our cells and can trigger cancer, causing, the growth of development and growth of cancer cells. So inflammation and oxidation are processes that contribute to a cellular environment that is more friendly to cancer growth. So anything we can do to knock down inflammation, reduce oxidation, those are, things we want to be including in our diet for an overall diet that's reducing cancer risk. And again, these are all found in those key plant-based foods, which seems to be a critical component of reducing risk of many types of cancer. So to help combat this chronic low-grade inflammation, we want to limit pro-inflammatory foods and eat more whole plant-based foods. So this is, again, reiterating what Nicole was sharing. We want to choose less of those foods that we think of as part of that typical American diet, processed and fatty meats. Saturated fat is a very pro-inflammatory compound. So we want to try to limit those sources of saturated fat. Also added sugars, so sugar-sweetened drinks, including soda, a lot of these flavored water drinks. I'm seeing a lot of electrolyte drinks. Many of them have added sugars in them. Also things like vitamin waters and sweetened coffees, sweetened iced tea. So things we really want to cut back on the added sugars in our beverages because they can absolutely contribute to weight gain. And again, a more inflammatory environment. Desserts and other sweets, candy and cookies and ice creams and things like that. Also, the added sugars that are found in processed foods like snack foods and breakfast cereals and bars and things like that. And then also refined grains. So there was a question about what is a white product. And when we're talking about white products, we're talking about refined grains that have been sort of, again, stripped of much of their fiber and nutrition. So things like white bread, bagels, unless we're talking about a whole grain bagel, which we don't see as often, white rice, white pasta, and most snack foods are made with white flour, various crackers, cheese puffs, pretzels, all those types of things. What we want to choose more of, again, you're seeing the consistent message across the board here. It's nothing if not consistent. We want to choose more plant-based foods because these are the plant foods that have those beneficial compounds. So those beneficial antioxidant, anti-inflammatory phytonutrients. Beans and legumes. So that includes any kind of starchy bean, like black beans, cannellini beans, red beans, kidney beans, all of those types of starchy beans, as well as lentils, vegetables, especially brightly colored, because the more color a vegetable has, generally is a good indication that it has more of these antioxidants in it. So the dark green vegetables, the bright orange, like your carrots and your sweet potatoes and your bell peppers, so beets, all those brightly colored vegetables loaded with antioxidants. Whole fruits, as Nicole mentioned, we want to try to limit fruit juices. They're a concentrated source of sugar. It's not added sugar, it's natural sugar, but it's still a concentrated source of sugar, extra calories, not great for our blood sugar. We want to try to eat more whole grains. So things like whole wheat pasta, whole grain breads, brown rice, quinoa, popcorn's actually a whole grain, oatmeal, oats, and nuts and seeds. Another question we get a lot as oncology dietitians, are there specific foods or are there specific like phytonutrients I should be eating to reduce my risk for prostate cancer or to reduce my risk for recurrence? And the bottom line on this is that studies looking at individual foods and nutrients have been inconsistent in their findings. There are some, foods that have shown more promise than others, but I will say across the board, again, nothing definitive, fully conclusive in terms of a lot of these have some studies showing a benefit, some studies, when we get like better quality studies in actual people, the animal studies are promising or the lab studies are promising, but when we start looking at data in humans, we're not always seeing a consistent benefit. Either way, all of the foods I'm going to talk about are healthy foods that you absolutely can include as part of a healthy, mostly plant-based diet. And it's just a little unclear at this time of what effect they are having in terms of prostate cancer risk. So the first one is soy foods. So soy foods include things like tofu, edamame, soy milk. So these are foods that have these isoflavones, which we sometimes call these they sort of have the isoflavones, you might have heard them referred to as phytoestrogens or plant-like estrogens. They have an estrogen-like structure, but they are not estrogen itself. And I get a lot of questions, is soy beneficial or not beneficial? It has these compounds that sort of sound like they might act like a hormone. If anything, the research has been positive in showing that they may be beneficial for reducing the risk of prostate cancer. So they are definitely something you can include as part of your diet, safely include in your diet if there's something you're interested in eating more of. The other positive to soy foods is that they replace some of those animal proteins that are high in saturated fat. So soy is a wonderful source of plant-based protein. We're trying to eat more plant-based protein, more beans, more nuts, and soy can be part of that. It doesn't have that high saturated fat content that we see from animal-based proteins, and it can be another protein alternative. If you don't love tofu, you might try like incorporating some edamame, which are the actual soybeans. You can buy them frozen in the frozen food section. They make a great high protein snack. You just steam them and then pop them out of their shells, and they're a great little snack. You may have seen them at like a Japanese restaurant. So another way or some people like the roasted edamame. It's almost like a snack food. They're roasted and lightly salted. You may have seen those in the grocery store. Lycopene. So lycopene is found in the hallmark food is tomatoes. So you've probably heard, you may have heard of this relationship. You should eat more tomatoes if you have a family history of prostate cancer or you have a prostate cancer diagnosis. Initially, like the research was very positive that eating more servings of tomato products, we were seeing a benefit, reduced risk of prostate cancer. Some of the more current studies haven't been as promising. Tomatoes are, of course, a very healthy food. They are very high in lycopene and other antioxidant compounds. Just be aware that when we're looking at some of these studies that showed a benefit, we're not talking about like 1 or 2 servings a week. Some were at least 4 servings a week. Some were at least 10 servings a week of tomatoes. So like a half a cup of tomatoes 10 times a week. Know that cooked tomato products like marinara sauce, canned tomatoes, they have more lycopene. The lycopene is more readily accessible. So those are good to include, even like a salsa, which can be a healthy dip for veggies or maybe, other things. The next one I wanted to cover was green tea. Another food I get a question, should I drink more green tea? I have a history of cancer. You've probably heard some of the benefits of green tea, and EGCG is one of the specific compounds, antioxidant compounds that's in green tea. It's a polyphenol. And again, this compound has been shown to have pretty potent anti-cancer effects when we look in like cell studies, at the cellular level. But in terms of what do we see in human studies, we do see that, we have some population studies showing that higher intakes of green tea are associated with reduced risk of prostate cancer. And in Asian countries where we see the highest intakes of green tea, we do see some of the lowest rates of prostate cancer mortality in the world. However, it's not, that's an interesting fact, but there's a lot of difference between the, sort of the typical diet in these Asian countries compared to the standard American diet. It's not simply green tea. Randomized controlled trials with some green tea supplements have shown maybe slowing of a progression of prostate cancer. Some studies have found no benefit. At this time, we certainly don't have evidence to recommend a green tea supplement. If you want to try to incorporate green tea into your diet, a few cups a day, I think that's absolutely something to encourage, but you don't want your tea to be a source of added sugar and start adding a lot of honey or sugar to sweeten it, because that's going to offset those healthy benefits from the compounds in there. So definitely want to do unsweetened tea, whether it's hot or iced. And lastly, I get questions, you may have heard pomegranate is beneficial for prostate cancer. Pomegranate, it's a brightly colored fruit. Again, very rich in these phytochemicals that act as antioxidants. Again, similar story, initial studies, population studies showed maybe a benefit. And then we saw there were a few like controlled trials that didn't really show a benefit. So a little bit mixed there. I think the trick with pomegranate is a lot of people would start adding it in the form of pomegranate juice, which is, as we said, juice is a concentrated source of sugar, a lot of extra calories. So if you want to incorporate pomegranate in your diet, ideally you'd go for the whole fruit, which you can buy whole pomegranates. You see them more over the winter months in the grocery store around the holiday season. You could also buy tubs of the seeds, the whole pomegranate seeds, which you can put on yogurt, put in oatmeal. So it'd be better to incorporate those, or maybe just a few ounces of the juice a day. Instead of doing a glass of it, you could put a splash of it in plain seltzer or plain water and just take a little bit of it that way. But bottom line, a variety of these phytonutrients is best, so eat a variety of colorful fruits and vegetables. I know it's nothing groundbreaking, but that's really what the evidence shows is most beneficial for reducing cancer risk. I did want to take a few moments to discuss dietary supplements and prostate cancer, because there's actually quite a few studies in this area that have shown harm from dietary supplements. I'm always getting questions, is there a vitamin I can take to reduce my risk for cancer? Supplements are not always safe, and getting more of a particular vitamin or mineral is not always better. And there's some classic cases here to show you why that is. So one of the major studies, it's actually, I just learned this myself, the largest clinical trial of supplements ever done in terms of studying for cancer prevention was this SELECT trial, the Selenium and Vitamin E Cancer Prevention Trial. And this was conducted by the National Institutes of Health, started in 2001, to see whether selenium and or vitamin E supplements were beneficial for reducing the risk of prostate cancer in men that were healthy at the start of the study. And the reason they did this study was because they had lots of population studies showing that men that had higher levels of selenium or vitamin E, or men who consumed more of it in their diet, had a lower risk of developing prostate cancer. So wouldn't it be a great idea to give them a supplement and see if getting a regular dose on a daily basis could reduce the risk for prostate cancer? Well, this study was actually terminated early because they started to see an association between the men in the study who got the vitamin E supplements and a higher risk of prostate cancer, exactly the opposite of what they expected. They started to see this trend initially. They stopped the study. They continued to follow the participants in the study. And the longer they followed them, the more significant, the more clear the relationship became. So it was conclusive by, as of 2011, the updated results showed that men who took vitamin E alone, because in the study, they either got they got a placebo for each, like or they got vitamin E and a placebo, or selenium and a placebo, or vitamin E and selenium. So there were 4 different groups. Those who got vitamin E alone without selenium had a 17% increase in prostate cancer risk compared with men who took placebo. And then another reanalysis in 2014 showed that men who had already had high selenium levels at the start of the study and who were randomly assigned to get the selenium supplement, so they were already high, they gave them a supplement, they had an increased risk of high-grade prostate cancer. So bottom line, these are not supplements we would recommend anyone with a history of prostate cancer take, or a family history that you're trying to reduce your risk. This is the highest quality of study, a randomized controlled trial, and the results were very clear. So not something we would recommend. Another study, a Harvard study following male health professionals, so basically a large group of doctors and other health professionals, found that those who took zinc supplements of more than 75 milligrams a day, or those who took zinc supplements for 15 years or longer, had a substantial increase in the risk of lethal and aggressive prostate cancer. This was not a randomized control trial. It was like a population study where they follow the men, but still an alarming finding. So bottom line, getting adequate amounts from diet. So these are all minerals found in healthy foods, plant foods, vitamin E is found in like vegetable oils and nuts and seeds. Selenium is found in certain nuts, fish, poultry, eggs, whole grains. Zinc is found in nuts, seeds, vegetables. So again, getting plant-based or whole food sources of these, perfectly fine. Or the small amount that you get in a multivitamin, perfectly fine. But taking high-dose individual supplements of these is not something we would recommend. And I think it's a big cautionary warning overall. Again, these are vitamins, these are things our body needs, but taking them at very high levels above what we can get from our diet may not be beneficial. So an important cautionary tip. And I'll finish up by talking about alcohol in prostate cancer. So alcohol is a group 1 carcinogen, so the highest level of evidence showing that it has cancer-causing effects, just like in the same category as tobacco. And there is strong evidence that drinking alcohol increases the risk of multiple types of cancer: colorectal, esophageal, liver, mouth, pharynx, and larynx, so throat cancers, stomach cancer, and breast cancer. The evidence for prostate cancer is not quite as definitive, though there's certainly evidence there suggesting that an increased risk of prostate cancer with higher intake of alcohol. So according to American Cancer Society guidelines, it is best not to drink alcohol. And men who choose to drink should limit, the American Cancer Society says men who choose to drink should limit their intake to no more than 2 drinks per day. Women, that's 1 drink per day. I personally advise my patients to be much more conservative on this, given, again, that we know that alcohol is a cancer-promoting compound. I'm going to hand it back to Nicole to wrap up, and then we'll take questions.
Thanks so much, Johanna. So just to wrap up everything, the recommendation for a diet for prostate health is going to be heavily plant-based. So that should be at least 8 to 10 servings of colorful fruits and vegetables daily. So in order to kind of make things a little bit easier, if you could try to eat 1 cup or more with at least 2 meals per day. And that would be if we're looking at like servings of fruits and vegetables, a half cup of like cooked vegetables would be a serving, or like raw vegetables like broccoli, things like that. And then if you're having like leafy greens, it would be a cup would be considered a serving. You want to make sure you're including beans and legumes, whole grains, and other high fiber foods, as well as limiting meat and dairy products. You should avoid juice as the fiber has been removed and juices are high in quickly digested carbohydrates. In addition, we're going to be aiming for a very high fiber intake, at least 30 grams per day. Try to meet your fruit and vegetable goal. This will be one of the easiest ways to get enough fiber in your diet. Make sure, again, you're including whole grains, legumes, and beans. If you're having a hard time getting fiber in your diet, you can add things like chia or ground flaxseed for additional fiber. And just make sure if you are adding flaxseed, it does have to be the ground one. You do not want the entire whole flax seeds because it's really not going to be providing as much of a benefit because they're really not digested well. And the other benefit with high fiber is it can help control your insulin levels, which we do see can help reduce like the risk or progression of prostate cancer. We want to avoid or limit refined carbohydrates and added sugars. Watch our fat content. So we're choosing healthy plant-based fats like the flaxseed, walnuts, soybeans, olive oil, avocados, also fatty fish. Animal fats do appear to increase your cancer risk and possible recurrence. We are avoiding high dose dietary supplements, especially selenium, vitamin E, and zinc, and to limit or avoid alcohol. And then just overall making sure you're getting enough exercise and trying to maintain a healthy body weight as able.
So I would just like to say that we appreciate you for joining us today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Nicole and Johanna and for dedicating your time and expertise today. And if you have any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499, option 3. That concludes today's webinar, and I hope you all have a great day.